As we get into screening and intervention, Michael, I just want to stop there too and see if there's any feedback, thoughts on the early childhood years that we just covered.
I have another question. I think it's a response to the first one, which is the complaints about physical ailments. It was helpful. I think it's always tough to figure out. My thought is the trauma could be real enough where physical ailments are brought up every time a task demand is given. It could also be conditioning where the child learns the action they need to take to escape the work. This doesn't need to go into any further. I think it's a base on the individual and always looking for tips to separate the true great response. The other thing I will share is following as an elementary school teacher, I actually became I was a social worker with the Department of Children and Families doing child protective services. And I had one client come in that had kind of a history of this. So I went to the school nurse to ask, can I see the file records? Just to get an idea of what was the pattern of behavior. They handed me a notebook of information. And I'm like, hey, no, HIPAA, I can't see any other student's information. Like, no, I understand. That entire notebook is that one student. And it was probably about 3 inches thick. So patterns of behavior are going to show out, one or two occasional, but I think the response is correct. You kind of have to look to see deeper what is actually going on. Is it learned? Is it trauma-based? What is going on? And so it's individual by individual. So just that real quick follow-up, Jerrod, came in.
Thank you, Michael. Thank you, whoever asked that question. One more thing popped in my head about that question. Google alexithymia. That comes to mind too. That could be a factor where that student may have a hard time naming, labeling, processing emotions. They're overwhelmed. Maybe they're being bullied. Maybe there's that test and they don't have good coping skills because there's an emotional block. And if there's that emotional block, they may start complaining of headaches and stomach aches and dizziness and rapid heartbeat. That could be another variable. But again, it's tough to know what the true cause is. It's likely multifactorial. So the next section, screening, just some things, again, to plant the seed. I'm going to go through this a little quicker because we laid a good foundation, but really, if we want to combat criminal behavior, the neurocriminology literature really talks about focusing on prenatal care, maternal care, early childhood risk factors. Now, again, I believe most of you probably work with adults, but even as adults, combating these things, addressing them, using these interventions that we've talked about and more that I'll point out to you can make a difference. Obviously, supporting mental health in children, being aware of those poverty factors, maybe there's some undiagnosed health risk factors, getting that child connected to the proper supports, services. If they're living in an environment where parents are really harsh, maybe the parents would do well with some parenting education. Unfortunately, if we look at what's going on in Minnesota and around the country, the mental health needs of adolescents and infants and even adults is up and up and up. And part of that's probably the after effects of COVID. So the needs seem to be increasing and not going down. Again, if you're working with an adult 30, 40, 50, 60, a lot of what they're dealing with at that age may actually be rooted back to early childhood or in utero types of things. And one thing I didn't talk about in that last section that's still a form of trauma is, has your client ever had a history of covert kinds of trauma where maybe they grew up in a home and maybe they weren't abused per se, but there was a lot of nonverbal cues that made that child feel invisible, or the parents just made it known that that child's not wanted. Abandonment, enmeshment, parent-child role reversal, reversing the blame, invalidation, minimization. These are all examples of covert traumas that might be difficult to detect, but they can be equally damaging to your client's emotional and behavioral health. If you work with parents of any kind, the more we can support them and support well-being, we're going to be in good shape. If you're working with solo clients who are adults, anything you can do to support their well-being is a good thing. The well-being literature is vast. There's physical aspects of well-being, so maybe getting that client connected to a doctor or a dentist. Dental health problems, we don't think about the connection there. Economic well-being, social well-being, emotional and psychological well-being. So well-being literature would be something you would want to just be aware of. And anytime we can promote well-being in your clients, typically they're going to just think better, feel better, and have a better outlook on life. Prenatal stress, I think we've covered that well now, but again, just know, I guess a couple things to think about when we look through this lens. What was going on in that family system during pregnancy or right before pregnancy? Financial challenges, maybe it's parental unemployment, housing instability, exposure to violence, or caregivers using drugs or alcohol, incarceration of one caregiver, parents going through a high conflict divorce or dealing with a high level of conflict, things of that nature, lack of prenatal care, could be some grief and loss issues. What kind of distress was that caregiver going through as well? Personal, family, social, education distress. Very important to consider the level of stress in that family system. And just visually show you here, again, I'm not asking you to be experts on any of these things, but just know that there's a multitude of stressors just to be aware of, to keep in the back of your mind when you're working with some of these really complex and challenging kinds of clients. So again, psychological, emotional, behavioral, biochemical, could be blood sugar dysregulation, hormonal issues, the environment that person lives in. Are they living close to that factory, a busy freeway? Are they living in an environment where there's a lot of lead or mercury exposure? Socioeconomic status, all of these things you'd want to consider. And depending on what age of client you're working with, this really applies to anyone, but why do you want to care about this when you're working with adults? Let's say your adult client just got out of prison, and during prison, it was just horrific for them. They were under so much stress. When they get out and come to you in whatever program you're in, this is what the research says. Just a few things you want to be aware of. Chronic stress exposure may contribute to more negative emotionality, which could be anger control issues, mood swings, irritability, rumination, impaired emotional regulation. So that client, when they're stressed, when they're confused, when someone maybe looks at them wrong, they just go from 0 to 60 in a second. You might see that. Cognitive distortions could be a client who has a lot of all or nothing thinking, black and white thinking. They just think the future is just terrible. And if clients think like that, good luck on them being successful in treatment. This inhibition we'll talk about extensively in the executive function training. But think about this is basically our brain's parking brake. And if we have decreased inhibition, we're going to be more impulsive. We're probably not going to think through our actions. And if you work with a client with a high level of disinhibition, they're probably going to have a hard time controlling their emotions on the job. If someone looks at them wrong or says something, if your client drives and they get cut off on the freeway, people with low levels of inhibition may be more likely to engage in road rage, which is a component of impulse control. Disinhibition, this is what it could look like. This is not an all-encompassing list. These are just some red flag indicators to ask yourself when you're working with your clients. This could be indicative that there's something going on with their inhibition, which is indicative of executive function impairments, which goes to the heart of goal planning, decision-making, problem solving, how they function in the home environment, and how they do in the job, to name a few. So any one of these things could happen, likely a combination, and disinhibited behaviors can be exacerbated by sleep deprivation, chronic stress, nutritional deficiencies, the list goes on. Other risk factors just to take into account, just to visually lay it out here. I think we've covered all of these, but just to reiterate and show you individual factors your clients may be dealing with. This could be caused, these biological factors, by excessive sugar consumption. Cognitive, I'm going to use that interchangeably in this series with executive function. What's their emotional state like? Are they dealing with alexithymia? Are they dealing with high levels of negative emotionality? At the systems level, family, friends, their school, their neighborhood, just take all these things into account. And then at the cultural or societal level, histories of poverty, racism, oppression, marginalization, and so on. I do a lot of talks and more podcast appearances now on the topic of neuro counseling. If we have any therapists in here, counselors, or even skills workers, you would probably do well learning about neuro counseling. It's basically taking neuroscience research and applying it to counseling practices with clients. And in the neuro counseling research, this topic comes up. This is not like a risk assessment tool where you'd fill out a bubble sheet, but I wanted to show you this. It's just something to take into account of all the things that could contribute to brain-based dysfunction in your clients. I mean, there's a lot of things going on. We've talked about a lot of these, but we haven't talked about all these. We will throughout this series. This is a topic I'm doing more and more work on. I'm getting more and more emails and requests for consultation and training. Is excessive screen time exposure. I don't think we think about that topic either. If you have clients just glued to the TV, glued to their phones, they're on the screen all night long, that's been linked with all kinds of health problems, emotional problems. So another screening variable to take into account is how much time they're on the screen or the internet or their gadgets. This really goes to the heart of why we're looking at it through a neurocriminological lens, because we have to not only take into account mental health factors, but health risk factors as well. Taking into account the importance for your clients to stay in regular contact with their healthcare providers is highly recommended because there's an interconnectedness between physical health and our mental health. The pregnancy complications, just to remind you that that could be a factor. So if you get access to early records, something to be aware of. Any kind of history of growing up in a very inadequate home environment could be parental abuse, neglect, invalidation has been linked with an increase in possible problematic behaviors later on in life. We'll talk about this next month or in a couple of weeks when we do the executive function training, but this is a component of executive function. This is a critical aspect of intervention that we all need to be aware of. If you have clients that have cognitive inflexibility problems, those are clients that are going to be more rigid, just really going to be kind of just stubborn. It's their way or the highway. They're never willing to hear other people's perspectives. If you can help them be more flexible and adaptable, that's probably going to help build their resilience and help them reduce irritability. So helping them become more flexible, great thing. Practically speaking, if you have clients that are like this, the research says just going for a walk with the client may actually help. When we start looking at this too through that criminology lens, going deeper into this, this is a term you'd want to be aware of, is antisocial potential. This is in the criminology literature. These are some risk factors that you may see earlier on in your client's life that may be indicative of repeat offending behaviors. We've covered most of these now at this point, but looking at the family, developmental factors, histories of attention hyperactivity issues, targeting social skills, and a number of other things we've talked about. And when we're thinking about this through that externalizing lens, these behavioral problems, these are other things you'd want to take into account, maybe looking at in your client's history. Symptoms of untreated ADHD, looking at their school history, the poverty, these are potential risk factors that may bring your client into contact with the criminal justice and legal system later on in life. And I think most of you, again, are working with adults, but these are risk factors found in the juvenile offending literature. And a lot of times these things start popping up earlier on in life. So I just want to reiterate, these are things just to be aware of that may be in the histories of your clientele. So we've covered, I think, most of these now at this point. Targeting problem solving is a really good intervention. If any of you are interested in working with people through a problem solving lens, I know there's an evidence-based practice that you can find training programs on online. It's called Problem Solving Therapy. It's really targeted to help people improve problem solving. That's the good intervention to look into. But these are all things to take into account. And if you have any questions on any of these topics, again, just type them in the chat box. Michael, before we go to the last section with tips, strategies, solutions, interventions, do we have any questions on the screening section?
There is nothing that's been typed in, but let's give it a second just in case anyone has anything. If you want to either be unmuted, raise your hand, or if you want to type in a question, go ahead.
And Michael, anything from your lens, just with your fantastic background on the screening stuff, anything I missed?
No, not that I can see. Fantastic background. No, but nothing that comes to mind. No, but I would defer to anyone else in the room that's probably got far more experience or background. Not seeing anything, Jerrod. So go ahead. Let's go into the intervention considerations in the next section.
You bet. So we'll wrap up with the good stuff. We talked about a lot of tough stuff. Let's end on lots and lots of things we can do about this. And I'll save some time at the end, and I'll stick around as long as we need. So if we were to start incorporating neurocriminology interventions into the work we do, what would that look like? Nutritional interventions are talked about. Again, I'm not saying you guys would be the ones doing the nutritional interventions, but referring the client to a nutritionist. Helping the client stop smoking would be something you guys might want to consider. Being aware of some of those biological factors we talked about. Being around positive people and just using attachment-based approaches, trauma-informed care approaches, focusing on helping that client feel heard, known, valued, respected. These are all things good for any kind of clientele that you're going to be working with. Again, ideally in a perfect world, these interventions would have started prenatally. Does that happen in most cases? Absolutely not. But again, as Michael said too, at any point in your client's life, no matter how old they are, if we start implementing some of these interventions, things can get better. And I think they will get better. You may see some bumps in the road. You might take 2 steps forward, 1 step back. Stay the course. The more you can understand these complex topics, you will be in a better position to develop an individualized goal plan that will target your client's limitations as well as capitalize on their strengths and resources. Parenting begins prenatally. So if we have anybody in here that does work with parents, a lot of times people think parenting begins after birth. It actually begins prenatally. So study like epigenetics research. Look at the research on oxytocin production. That's a neurohormone that's related to bonding. It's a bonding chemical that plays a huge role in attachment. And there's some studies that show at the neurochemical level, some high-risk offender populations may have abnormalities at that biological neurohormone level. So focusing on these things prenatally, again, ideally, but at any point in life can be helpful as well. When we focus on these things early on in life, obviously that can play a critical role in brain development, but anything we can do to help that client developing trusting relationships with other people can actually help improve brain development. Getting that client to learn how to communicate more effectively or create a desire to want to learn something, like take up a new hobby, that's been shown to improve brain development. When we talk about brain development and like neuroscience research, just understand like neuroplasticity. That research really gives me hope that the things we do, the interventions we do, can actually make a difference at any point in a client's life. Teaching them empathy, developing moral reasoning, all of these things can be very good for brain development as well. Doesn't matter at any point in that client's life what kind of clientele you work with, you're not going to go wrong utilizing trauma-informed care approaches. Because unfortunately, again, we know that almost all the clients that are coming out of the criminal justice system have had extensive trauma histories. And trauma has been linked, untreated trauma has been linked to robbing people of their joy and their creativity and their energy and their motivation and their self-control and their sleep. Another reason why it's so important to take into account trauma-informed care practices. If you haven't had any training in trauma-informed care, I highly recommend seeking it out, but just give you a brief overview. Trauma-informed care, think of it as kind of creating that culture of safety and trust and empowerment. It's kind of at the organizational level. So think about whatever company you work for or organization, looking at your policies, your procedures, your practices. Are you trauma informed? Are you trauma sensitive? Are you emphasizing safety and stability in your workforce, even among your coworkers? You're really being mindful that the interventions you're using with your clients are not harming them and re-traumatizing them. This comes from a strengths-based approach, really focusing on empathy and attunement. All of these things can help your client thrive. And in the criminal justice literature, you will find numerous studies that really promote the use of trauma-informed care approaches. And again, when we're working with clients with these trauma histories, it can impact their brain. So taking into account how they learn. If you work with clients that have a long-standing pattern of memory issues, or during your interview with the client or intake, they just can't seem to pay attention to you, stay curious. Could they have a history of trauma that's causing them to have these issues? Maybe during the interview, they're struggling to articulate themselves. Extensive trauma has been linked with language problems. Your clients that have had these early childhood experiences that we've been speaking about, as they get older, they may have more problems in interpersonal relationships. And if they do, look at their histories of employment. Do they have a long-standing history of walking off the job or getting fired, or in and out of relationships, getting married, divorcing over and over again? Some of that could possibly be linked with childhood trauma, and extensive childhood trauma may contribute to any one of these things on this particular list. And if you're starting to become trauma informed, I just gave a talk 2 days ago, I think now, to Ramsey County. If any of you were part of that, you heard me talk about trauma informed interviewing. Any kind of interview you do, if it's an intake, it's an assessment, a screening process, whatever you do, if you're an HR worker and you're hiring people, if you look through a trauma-informed interviewing lens, better outcomes can happen. These are just 5 critical components you'd want to take into account if you wanted to start moving in the direction of becoming a trauma-informed interviewer. We've talked about attachment. If you're working with clients that have had long-standing patterns of criminal justice involvement, there is a very good likelihood that they probably are dealing with some level of attachment-based problems. And when your client deals with attachment-based problems, that can impact the way in which they function in life, trust issues, empathy, how sensitive they are to other people. Fractured attachment patterns have been linked with more drug and alcohol problems, more emotional dysregulation. Secure attachment patterns. So when you become trauma informed, you're kind of already becoming attachment informed, but you'd want to learn about attachment-based approaches, because the more we can instill attachment interventions into the work we do too, helping clients develop a more secure attachment base has been linked with having better stress management, regulating their emotions and behaviors, being able to take what you're teaching them and then use it in different settings. They're going to be more likely to want to learn social skills and probably have better social skills, and they probably are going to do better in school. So focusing on understanding attachment and really building that up too in the clients you work with. And if you work with clients that have these fractured attachment patterns, it has been linked with more psychopathology, which is just a fancy way of saying more mental health problems, depression, anxiety. It could be a factor in having limited social support. So if you have clients that just don't seem to have any friends or family, that could be partially linked with having more insecure attachment problems. And when the question came up earlier about the child in school, could insecure attachment problems be a factor as well? Because insecure attachment has also been linked with having more physical health complaints. So these things, again, start in utero. This is just one study of many that really talk about focusing on prenatal interventions. And this one study found that by targeting these prenatal interventions, it did lead to significant reductions in juvenile delinquency even 15 years later. Scaffolding-based interventions, I'm a big fan of using these. Any kind of job you're in, I think you do well using these kind of interventions. A lot of times people that work in the school setting probably are the most familiar with this, but I think this can be used in any setting. But this is a type of instructional method, and they use it as a tool for growth. So you're providing examples, maybe guided instructions, not just telling the client, hey, go do this, but you're sitting with the client, you're showing them how to do it, you're giving them examples, you're modeling, you're using visual aids. Sometimes these can be taught in like a social skills group. This can be very helpful in helping clients achieve goals, and it's also very helpful in helping clients learn how to stay more regulated. I wish we had a whole training on this topic, but I wanted to just plant the seeds here. I'm focusing a lot on the gut now. Why should you care about the gut? Because of the gut-brain health axis. And the gut-brain health axis basically indicates that if you work with clients that have mental health problems, they probably have gut health problems. And if you work with clients with gut health problems, they probably have mental health issues. This is a really fascinating area of research, and problems in the digestive system are common among all kinds of disorders. So if you are working with clients with mental health disorders, the research says something in their gut is not going well. I'm actually giving a talk next Tuesday on the forensic and criminal justice aspects of the gut to a group out of New Jersey, I think. If you want my slides for this, just shoot me an email. And in the forensic literature, there are a few studies now talking about digestive health issues might be a very important target area for combating antisocial behavior. There's only a few studies so far, but my gut tells me in the next few years, we're going to be finding more and more studies talking about if you can target the gut microbiome and focus on enhancing digestive health functioning, it may actually play a role in reducing criminal behavior. And again, refer to a nutritionist, but I want to point out that food allergies could be a factor in some cases of criminality. If someone's dealing with an undiagnosed food allergy, which is very common, that can throw off the gut. And if the gut's off, that can impact the mood in your clients. So referring them to get testing for this may actually be another way of maybe tackling the criminal behavior issue. If you have clients that have a tendency to skip meals, skip breakfast, consume a high degree of like energy drinks, again, sugar sweetened beverages, that has been linked with more executive functioning impairments. And if that's the case, it has an impact on their memory and their mood and their goal planning abilities. So just little things like this for us to be aware of that maybe we haven't thought of that can play a role in your client's ability to live a very healthy, stable lifestyle. These are things that come out of the neurocounseling literature, but a lot of these are just common sense. They're called therapeutic lifestyle changes. And it does talk about really focusing on nutrition interventions, managing weight. There is studies that have been talked about that people that go to prison put on a lot of weight and they come out of prison with increased weight. If you look at the research literature on obesity, that's been linked with all kinds of behavioral and mood problems as well. We talked about sleep. This is a very important thing for us to be aware of and to ask questions to your clients about their sleep health. I'm not saying go out and set up an exercise plan, but your client would probably do well with exercise and movement. Working with a qualified specialist, you will find a couple studies in the exercise literature that talk about the use of exercise interventions to also combat criminal behavior. And helping your clients reduce screen time exposure, another good intervention. So we talked about kind of some of those biological factors. Again, These are just common sense interventions that can actually have not only a positive impact on your client's psychological and social health, but also their biological health. If you're focusing on cognitive training, which is basically focusing on enhancing their brain functioning, that might have a positive impact on all of these factors. Exercise, diet, and getting your clients around other people, being more social, reducing isolation has all been shown to be helpful. And basically what this is if your client maybe deals with diabetes or cholesterol, or they have some cavities and they haven't been to the dentist in 10 years, go to the doctor, take care of these symptoms. This can be a very positive thing in supporting your client's mental and social health as well. I'm sure some of you have probably heard of the R&R model, the risk needs responsivity model, and the criminogenic risk factors. These are what is called the Central 8, which most like probation offices, the courts probably rely on when we are thinking about like offender reentry considerations. These are all very, very important. I'm not minimizing these. These are very important for us to consider. But what would happen if we also took these into account, but also applying a lot of the things I'm talking about through the neurocriminological lens? I believe if we brought these two models together, it would help reduce criminal recidivism and help us better understand the complex needs of many of the clients we work with. From a earlier intervention protocol, and this can be equally important for adults, if your client deals with a high level of distrust, they just don't trust anybody, could be a very important target area. Obviously, lots of anger and hostility are important target areas for us to consider. If your client, again, has these huge up and down mood swings, and maybe you work with a client where they come into your office and you're walking on eggshells and you can just feel that client's ready to explode. Or have you ever worked with a client, they're happy 1 minute, screaming the next, crying 1 minute, laughing the next? They probably have some emotional reactivity problems. Dig deeper into your client's history of risk-taking behaviors, not just drugs, alcohol, fighting, but look at their patterns of risk-taking behaviors with food, with money, driving behaviors, risky behaviors in relationships. Very important to identify and target because that is rooted in impulse control problems. And needless to say, if your client is dealing with a co-occurring mental health issue, referring your client to a qualified mental health professional to tackle that problem as well. Other interventions through an offender criminal justice-based lens that are supported, helping your clients develop greater self-monitoring abilities, teaching your clients how to be more mindful of their own mood states, their own triggers, really capitalizing on goal planning and goal setting. Next time we get together on the executive function, we'll go deep in the weeds with that. Anytime you can teach your clients self-control, putting on the brakes, pausing and reflecting, going to be a really good thing. Enhancing their social and interpersonal skills if they have a drug or alcohol problem, focusing on that, but take it a step further. Targeting tobacco use, targeting excessive caffeine or sugar consumption is equally important. These things can be done one-on-one. Group work can be very helpful, and lifestyle modifications is really looking at your client holistically, their sleep patterns, their screen time habits, anything they do in their life that might not be good for them, maybe target that with interventions. We all probably have had some training in CBT, cognitive behavioral therapy, but this is just a snapshot of what the literature says when working with criminal justice-based populations. I'll talk about this next time we get together in greater detail, but abstract reasoning is your client's ability to understand how and why questions. And again, maybe your client's court ordered to go to treatment. And if that therapist uses insight-based therapeutic approaches with someone with abstract reasoning deficits, that's not going to go too well, and the client's probably going to bomb out of treatment. These are all things that CBT can target. And if your client struggles with perspective taking during an interview, sitting face to face with one of those clients, they may come off as bored or callous or unempathetic, and they're not paying attention to you. Really helping improve these things has been linked with reducing offending behaviors. And a little bit more about CBT. I can't stress enough, CBT has been studied over and over again, but it can also target all of these things and many more. So these are all factors to consider when we're thinking about criminalistic behavior and thinking patterns. And I mentioned the distorted cognition before. If you have clients that have any level of distorted cognition, these would be a few things to take into account and really target that, because if they have distorted cognition, the way they see the world, the way they see themselves, the way they see you can be completely distorted and really get in the way of that client truly being successful in life. And I'll talk about this too when we do the executive function, but metacognition is thinking about thinking, knowing about knowing, and in the criminal justice literature, having deficits in the area of metacognitive skills is a risk factor for criminal recidivism. So if you have a client that has poor metacognitive skills, this is what it could look like here. So if you see patterns like this with any of your clients, that should be a red flag indicator. They probably are dealing with some level of metacognitive skill functioning, and any one of these or all of these may need to be considered part of an intervention or treatment process. And other targeted interventions that you'll find in the literature, some of this stuff's common sense, we've covered it, but just think about some of these things. If your client has poor identity development, what's their values? Do they have bad ethics? Terrible morals? These are things to focus on. Taking into account, maybe your client deals with developmental immaturity. So an example of that would be, maybe you have a client who's 30 years old chronologically, but with some of these brain-based impairments and life history things we've spoke about today, maybe they function as a 10-year-old or a 15-year-old or a 20-year-old. They may be very immature. Targeting any one of these two has been shown to lead to better outcomes. And a few other things just to be aware of for screening and intervention. These are other just risk factors that you'd want to be aware of in your client's history. And again, some people that have had these histories will never grow up and have problematic behavior. But if you work with clients with a long-standing pattern of problematic behavior, criminal justice involvement, more times than not, they got some of these going on. So these are just things to be aware of through that trauma lens. And other interventions that have been talked about in the delinquency literature. Early intervention's key, but again, if you're working with adults, these are just things for us to be aware of and to target. And again, smoking prevention is actually a targeted intervention to reduce criminal recidivism. And I'll leave it on a very positive note. I'm a big fan of positive psychological interventions, and in the criminology literature as well. It does talk about the use of these interventions, and if you can help instill greater gratitude or optimism in your clients, that can lead to better outcomes. Several studies talk about the use of self-compassion interventions, helping that client just be nicer to themselves and start thinking better about themselves, may actually reduce criminal thinking. If we can promote self-efficacy, you're helping your client develop a greater belief that they can actually achieve their goals. That's been linked with all kinds of positive things. So positive psychological interventions, highly recommend as well. And as we wrap up, try to, where do we go with all this? I threw a lot at you. This is a master's degree worth of content in 2 hours. Some practical things to think about that we've covered today, and things that we're going to talk about throughout this series is just, I think, be on the lookout for these things. Consider these as possible variables that may impact your client. I didn't talk about noise annoyance in this one yet, but if your client constantly is being woken up in the middle of the night because there's lots of noise from traffic outside or even in the house, noise annoyance exposure has been linked with more mental health problems and more behavioral control issues. But these are some things for us to consider and to maybe start targeting through that neurocriminological lens. So that's all I got for you, folks. I will stick around as long as we need. If we have any questions, if there's anything I said you disagree with, I welcome the feedback, and please reach out to me too. Anytime, I'm more than happy to jump on a call with you.
This video is brought to you by Ramsey County Social Services and was made possible by a Mental Health Innovations grant. Thank you.